there is a group of people who do not want everyone to be here.
So who's the real problem here? Is it Sebi, or is it some pharmaceutical company that is willing to exploit us?
Did you know that in Europe and the United States, after cancer and heart diseases, prescription drugs are the leading cause of death?
If the herbs are for healing, when did it change from the herbs to a carcinogenic chemical, and why?
As stated by Marcia Angell, today, it is simply not possible to trust published clinical research and to rely on the understanding of doctors and physicians or the medical guidelines. Peter Gotzsche, leader of the Nordic Cochrane Center, also refers to modern medicines as a leading cause of death around the world. So, how are these medicines that we believe to be life-saving are not in reality?
Every part of life is being man-made. And the reason why is because you can't patent nature. You can patent anything you make man-made. When you make it patent, now I can make money.
Why did Dr. Sebi warn about modern medicines and excessive medical intervention? And what alternate solution did he suggest?
My parting word would be this: make sure that whenever you put something in your mouth, that something is going to complement you.
Let's get to know all in this video. The modern healthcare system is failing to maintain its high standards and practices for its primary goal, which is to improve the health of patients. Modern medicines, made from chemicals, are proving to be harmful to public health because of their overprescription.
Why do we go to see the doctor to give us a chemical when the Bible said the herbs are for the healing?
Peter Gotzsche, who is also the co-founder of Cochrane Collaborations, estimated that the modern medicines prescribed by doctors are the third most common cause of death globally. And why should we pay attention to the claims of Marcia Angell and Peter Gotzsche? These two are known for their years of experience in medical research, with accomplished careers in the medical scientific community. They are learned and well-informed in the profession, and in recent times have become critics of modern medical practice through their books, scientific reports, and journal articles. As these two are the present-day critics of modern medicines, we had a famous name in the past, Dr. Sebi, also known as Alfredo Bowman, the herbal healing hero with a great twist. Dr. Sebi was a man with zero formal education in medicine. However, to your surprise, he learned traditional healing from his grandmother. To be more specific, he did not attend any classrooms or lectures. He just worked on traditional herbal techniques. On many occasions, Dr. Sebi has claimed his alternative to modern medicines to be more beneficial and challenged doctors with their modern techniques.
We have been misled not only by the foreigners that are not part of our race, but we were also hoodwinked by our brothers that was trained by those people.
And what was his reason for this claim, you must ask? As per Dr. Sebi, his secret herbal mixtures directly work on diseases by fighting off the mucus in the body. His secret healing mixture is nothing more than vegetables, raw fruits, grains, and nuts. According to Dr. Sebi, the way to achieve a healthy life is through natural things, which most of us do not like to eat and place on the sides of our plates. His approach is more focused on naturally colored food, such as veggies and fruits, than relying on the pills.
My approach is an intracellular cleansing.
As per him, it would be a lot more useful to visit the veggies counter in a supermarket when feeling under the weather than to visit a pharmacy. Dr. Sebi advocates a life free from processed food, animal products, and other forms of hybrid fruits and veggies.
You see rice and beans and flour and cheese and meat and the starch that you eat, they all came from right here, from a laboratory.
Although his approach has been criticized as fraudulent, his followers consider him the master of herbal medicines. Officially, he was not fulfilling the criteria of being a doctor, as per the standards of the modern medical community, but he has proved himself through his personal health comeback story, as how he has beaten the illness and obesity that he was suffering from. Through his herbal and dietary routine, he claimed to have a cure for diseases like AIDS, diabetes, and cancer, as well as a cure for the blind to see.
When I told my mama that I had cured my 13 AIDS patient, she said, they're gonna get you. By removing these things from his diet and then cleansing his cells, he began to see recovery in 24 hours.
Despite his claims, the modern medical community was always critical of his methods and lack of proof, and warned the public not to risk their lives by cutting off modern medicines for Dr. Sebi's salad. When we look at the harmful effects of modern medicines, we have various studies criticizing their chemical composition.
how the healthcare hustle works. We bring you in, you're sick, we start you on treatment protocols that are many times more toxic than what we're treating you.
Some of you must have skimmed through if you are related to the field. The use of prescription medicines is at an all-time high in the UK, with almost half of the adult population on at least one medicine, and a quarter on 3 medicines. This data shows an increase of about 47% in the past decade. Contrary to this increase in the use of medicine, it is important to note that life expectancy in the UK has fallen since 2010. This is the slowdown of life expectancy in many of the world's leading economies. Contrary to popular belief, the cost of an aging population is not itself a threat to a country's welfare system, but an unhealthy aging population is a threat to that welfare. An analysis done by The Lancet found that health expenses are expected to increase by only 0.7% of the UK's GDP by 2060 if rising life expectancy means years in good health. On the NHS, the greatest pressure comes from managing almost entirely preventable chronic conditions such as heart-related diseases, type 2 diabetes, and high blood pressure. The expense of type 2 diabetes makes up the 10% budget of the NHS. A surge in heart attacks and strokes in England is expected over the next 20 years if diabetes continues to increase, as per reports from the British Heart Foundation. Despite all this, rather than taking care of the root cause of all these conditions by changing our lifestyles, many of us are depending more on medicines that only provide a minimal chance of benefits to patients in the long term, and in some cases, there are no fruitful results at all. The reality is that the change in lifestyle, as suggested by Dr. Sebi, not only reduces the risk of diseases in the future, but also improves the quality of life within weeks. However, the patients who are unlucky enough also suffer from the side effects of medicines and find their quality of life in a poor state to enjoy the small short-term benefits of modern medications. On many occasions, patients need to change eating habits and take medicines, but for that, the flow of information needs to be transparent and open to encourage shared decision-making. For instance, the Academy of Medical Royal College's Choosing Wisely campaign allows patients to ask their doctors whether they need a medication, test, or procedure. Professor Luis Correa, director of the Center of Evidence-Based Medicine in Brazil, says doctors must consider the likeness, values, and beliefs of individual patients. Otherwise, it will not work. Some of you might have a clue that the big issue that the modern medical field is facing is over-medicalization, or, to put it more simply, excessive medical intervention. Ever wondered about the term medicalization? The term was coined in the 1970s, and we need to understand it before moving on to what we can call its more complex form: excessive medical intervention. Medicalization refers to some conditions that are now defined as medical problems, but they used to be non-medical once. Let me clear the air with an example. Think about pregnancy. It was a natural way of continuing life form, but what we see today is that it is being treated as a health issue, requiring treatment and risk management even before it is due. Or we can take an example of alcoholism. It used to be a moral issue rather than a medical condition. And when we look at its more problematic form, which is excessive medical intervention, we come to realize the failure and complexity of our modern medical practices. How? You see, excessive medical intervention occurs when some personality traits and normal life issues are being treated as medical problems. What it means is that we started using medical help for things that were normal in the past and dealt with traditional methods. This is what exactly Dr. Sebi was focused on. He believed that we humans are natural beings, naturally created by God, and the solution to our problems comes from natural ways too, not from laboratory-made pills. Don't we have a point here?
God made us. We were not made by a laboratory. If we were the product of a laboratory, then it means that we could eat laboratory food.
To understand it more easily, consider shyness, which is a personality trait present in every one of us. The difference is only in its intensity. In recent times, medical experts have treated it as a social phobia or anxiety. However, it was not seen as a medical issue in the past, but today it is. The point to take home is that what used to be normal shyness is now known to people as a mental disorder. So you see, people like Dr. Sebi criticize that such cases lead to excessive medical intervention, which carries harmful effects for normal people in the future.
You have to have the understanding of biochemistry. But when we were here, we didn't have to know anything about biochemistry. Why? Because God doesn't make poison.
To begin with, excessive medical intervention leads to the burden of extra cost to the patients. Furthermore, another issue of excessive medical intervention is that the use of excessive medicines for relief is not based on objectivity, but heavily relies on the social judgment of others about the person and their social behavior. A person might only be considered a patient because his social skills are not in accordance with the existing social values in the culture, such as being confident, talkative, and determined. Furthermore, excessive medical intervention is a problem as it is based on problem solving at the individual level, with medical treatment for the normal people considered to be patients, rather than a collective approach to change the social culture and building societies based on love, as stated by Dr. Sebi, that we need to love ourselves and those around us.
That you have for you, that love would never die.
Lastly, it seems to be implemented in a major portion of healthy people who are fit in every aspect but are just concerned about their health. After the problem of excessive medical intervention with modern medical science, we come to the side effects of chemically made prescription medicines. These medicines are the leading cause of death, mainly due to their side effects. The meanings of the term side effects are hardly noted in the literature, and people usually misunderstand what it means. The term is used to describe the action of medicine that it does to our bodies, which it is not meant for. However, these medicines are made from chemicals in the laboratory.
I found that out, that everything that we put in our mouth is laboratory made.
And chemical substances do their things irrespective of what we want them to do. As experts say, side effects are just as much direct effects as the main effect for which a drug is prescribed. What Dr. Sebi wanted for us was a way to have a healing process without the side effects and the problems of modern medical science, such as over-medicalization. The herbal healer was once diagnosed with asthma, diabetes, impotence, and visual impairment by a Mexican herbal expert.
I had asthma, I had diabetes, I was impotent, I wore glasses, and I weighed 291 pounds at age 30.
He was given a sort of death sentence by the man who treated him.
The man looked at me and said that I was dying and that I had to change my way.
Which led him to start experimenting with different herbs and fasting methods. Not only did he manage to heal himself, but he also started sharing the treatments with people around him. His food therapy was mainly based on an alkaline plant-based diet and lots of natural supplements, which are to fight against the body mucus and to equip the body with disease protection better. His analysis was that the major cause of disease in humans is acidity and mucus.
Acid state influences the brain and the central nerve system. It changes the image in your eyes. You do not see with your eyes.
Which can only be controlled by eating certain foods and avoiding certain foods to detoxify the body. What does this detoxification do to the body, you must ask? It helps in achieving an alkaline state of the body that could reduce the risk and effects of disease. Dr. Sebi dedicated his 30 years to finding the healing potential of plants and herbs that they naturally contain.
If Jesus cured with herbs, Hippocrates cured with herbs, and God said the herbs, then what's up? Why aren't we curing with herbs today?
This became the beginning of what is known as Dr. Sebi's diet today. This diet consists of a specific list of approved vegetables, fruits, grains, nuts, oils, seeds, and herbs. Animal products are completely prohibited, which is why the diet is completely plant-based.
Every 50 grams of processed meats that you eat, it increases your risk for cancer by 16%.
Most foods on his diet are low in calories except for nuts, seeds, avocados, and oils. According to Dr. Sebi's guidelines, there are key rules one must follow when adopting a strict diet. You must only eat foods listed on a nutritional guide, drink 1 gallon of water each day, take Dr. Sebi's supplements an hour before medications, never eat any animal product. Alcohol and wheat are also not allowed.
Every 50 grams of red meat you eat, it increases your risk for cancer by 12%. So just think about that for a second.
You cannot use microwaves to heat the food as it kills the food as per Dr. Sebi. And lastly, canned food and seedless fruits are also not allowed in his diet. The diet shared by Dr. Sebi is rich in vegetables and fruits that lower blood pressure, reduce the risk of heart disease and stroke, prevent some types of cancers, lower the risk of eye and digestive problems, and have a positive effect on blood sugar levels. The fruits such as apples, bananas, dates, and oranges supply dietary fiber. Fiber intake is linked to a lower risk of cardiovascular disease and obesity. Besides this, these fruits are the source of necessary vitamins and minerals required for a healthy life. Similar to fruits and veggies, the grains in the diet, such as wild rice and quinoa, lower the risk of heart disease, which is the leading cause of death worldwide. Another addition to Dr. Sebi's diet is sea moss. It is the secret potion that kept him active and lively.
Sea moss have me doing things every morning like this. That's sea moss. Sea moss have me falling on my knees every morning to check them.
Packed with potassium chloride, omega-3s, and chlorophyll to reduce the inflammation in muscles faster than any other medication.
Sea moss is the best thing yet. Sea moss, man, the best I ever had.
With all the benefits listed, Dr. Sebi's diet is not left without controversies and criticism. Critics cry out the tight niche on what you can and cannot eat. This places a full stop for the people who have a wide variety of foods to choose from, but are restricted from animal products. No wheat, no beans, no lentils, and also a whole bunch of fruits and vegetables are off the card. The idea of having only a natural diet faced criticism when it came to certain fruits, veggies, and grains that were not allowed in the diet. As mentioned earlier, Dr. Sebi was not just about the herbal wisdom and plant-based diet. He was all in on self-love and emotional freedom too.
The love that's going to secure you through life is the love that you offer yourself.
The man who showed the wonders of herbs to the world also believed in the power of a healthy mind for a healthy body. Although the modern scientific community did not line up to back his alkaline diet with hard evidence, that did not stop many followers from adopting his suggested lifestyle, shedding pounds of weight, detoxifying their bodies, and even bidding farewell to chronic diseases, all by sticking with Dr. Sebi's diet. Dr. Sebi's client list also includes multiple celebrities and Hollywood stars such as Michael Jackson.
What I did for him was this. I gave Michael an intracellular chelation. He was full of a whole lot of drugs, the pharmaceutical drugs.
Lisa, Eddie Murphy, John Travolta, and the list goes on. According to many of his followers, it turns out that swapping the processed sugar Western diet for Sebi's plant-based diet did wonders for many, leading them to better health and lifestyle. And they say that nature's remedies grow in the garden, not in the laboratory. If you have come this far, be sure to check out other videos on the channel.